Common application issues. When applying the Stivax stimulation device, it is important to watch out for 3 potential issues. These issues, if not noted during application, may lead to the adhesive wearing out faster than it should, or simply not adhering to the patient in the first place. Issue 1. Proper anchor site preparation. The anchor site is the point on the patient's shoulder where the adhesive-backed holster clip is applied. During application of the Stivax device, make sure that the skin around the anchor site is cleaned and dried using the alcohol swabs included in each Stivax box. When preparing the area for application, make sure to use the training wires to estimate the distance between the insertion point in the ear and the anchor site before cleaning to make sure the proper area is being swabbed. After the area is cleaned and has dried, make sure the patient is calm and there is no additional perspiration on the area of application. If the patient is perspiring, then the Stivax adhesive will not stick well. This may lead to a premature wearing of the adhesive. Issue 2. Hair removal prior to application. When treating a male patient, make sure that the anchor site is free of excess hair. Many offices utilize an electric trimmer for ease of use when removing the hair from the application site. This can be done in a matter of seconds. If the excess hair is not removed prior to the application of the device, the adhesive will not stick flush against the patient's skin, and it will fall off quickly once the patient puts their shirt back on after the procedure is complete. Issue 3. Physical activity and female patients. When treating a female patient, note how active they are during treatment. Continued physical activity is perfectly fine when under Stivax treatment. However, when a female patient is active and wearing a sports bra, issues may arise. The holster that the Stivax sits in may disengage during physical activity if the sports bra is placed behind the Stivax. During activity, the elastic band will push against the back of the Stivax, dislodging the Stivax from its holster and causing issue with treatment. To prevent this, make sure the patient knows that when wearing a sports bra, to have the elastic band on top of the device instead of behind, as this will allow the device to be held down during physical activity and not allow the unit to become dislodged. The patient may have to adjust themselves as necessary during their physical activity to keep the band on top of the Stivax device. Identifying these 3 possible issues prior to application of the Stivax device will help your practice to continue applying Stivax devices with confidence and prevent issues with their patients.